Hello everyone, PESCI girl here. Today we want to talk about approach to facial rash, differential diagnosis, and how to manage it. We have several subtypes of rosacea. The first one is erythrotelangiectatic. In that case, we have chronic redness of the face, especially in the central part, nose, cheeks, and chins. We can also have some telangiectasia. The other one is papulopustular. In the case that we had, it's a kind of combination of erythrotelangiectatic and papulopustular because they can coexist. Another form is phimotus. In that case, we have overgrowth of connective tissue in the nose, and it's more common in male. And the last form is ocular form, which is characterized by feeling of dryness or pain in the eye. Triggers that are associated with rosacea are mostly emotional stress, hot or cold weather, sun exposure, exercise or having hot drinks, alcohol consumption, spicy food, and some medications such as topical steroid, niacin, and beta blockers. Treatment consists of pharmacological and non-pharmacological management. In non-pharmacological part, we can do is that firstly we inform the patient that it's a chronic condition, it's intermittent and inflammatory. We cannot cure it, however we may be able to manage the condition with medication. We can encourage the patient to keep a journal documenting exposure, diet, and activity that cause flare-ups. And we can tell the patient to use broad-spectrum sunscreen, avoidance of midday sun, and shade and protective clothing that can be helpful. We can advise the patient that use soap and abrasion-free cleansers. Moisturizer should be used if the skin is dry, and avoid use of abrasive materials and pat dry for better absorption of moisturizers. In pharmacological management part, we start with topical agents such as metronidazole, and we review the patient after 4 to 6 weeks. If there is no response after 4 to 6 weeks, we can add oral agents such as oral doxycycline and review patient for another 6 to 8 weeks. If there is no response at that time, we can considering referring the patient for dermatologist for starting isotretinoin that can be helpful also for ocular form. We can add another antibiotic like erythromycin or continue doxycycline for 3 months. We can use other topical form like ivermectin for 3 months.